Young people as well as adults, the earlier we intervene, the less we're likely to compound. Randy, you were talking about dual diagnosis, right? The less that likely you are to see a substance-related dual diagnosis if you have an earlier intervention.
Yes, you can be the most trauma-informed person, parent, caregiver in the world, but until you've recognized and dealt with your own trauma, it'll be difficult to help the child because it will seep in.
Those of us with serious mental illness in our families know trauma well. And sometimes trauma is that second hit that can exacerbate the situation. Our guests on this episode share knowledge and tips and their own experience in trauma-informed parenting. Why? Because when parents are trauma-informed, they're better equipped to help their children and themselves to heal. Welcome to our podcast, Schizophrenia, 3 Moms in the Trenches. From the place where schizophrenia and real life collide. East Coast, West Coast, Middle America. With Miriam Feldman, Mindy Greiling, and Randy Kay. Well, we're just cranking out the episodes, 1 a week these days, right, Mindy? So good to see you.
Our head is turning.
I know. I'm like, but it's just so gratifying. This week, by the way, my friend, we reached over 200,000 downloads, which is a real milestone.
Congratulations to us. I did see that somewhere on social media. Maybe you put it up.
I did put it up. It's I took a screenshot because I guess the people who host our podcast, the next big milestone is 250,000 downloads. But I thought hitting a 2 in that thousands column was pretty, it made me happy. So, and it's thanks to our
remarkable.
Listeners. It's thanks to, our listeners. We're on episode 106 tonight, and you have listened and you have shared and you have written to us. We just got some fan mail, which I'll forward to you, Mindy, from Australia, somebody struggling there, and just time and time again, especially in the last few weeks when I've been sharing I'm in a rough patch with my son, Ben, as listeners well know. He's still spiraling down. And I have to say that hearing from the listeners has been so helpful and a reminder that no one is alone. So last week we talked about housing and a lot of people writing to say, yep, it's hard to find. Has Jim gotten in yet? When's the move-in date?
Well, you notice on the last program, I was announcing to the person that's in charge of where he's going that I will be sharing on this podcast his status. So I thought that was good lobbying on my part. But Ellie Skelton, our guest from Touchstone here in Minnesota, let me know the next day that he is first on the waiting list. And just to give our listeners an idea of what that means, it's estimated to be 6 months. 6 months. That's when you're first on the waiting list. That is how desperately we need more supportive housing for people with serious mental illnesses.
Absolutely. Wow. Well, I hope that it's shorter than that, but at least you have something to look forward to. So
it just lightens my whole load to know that it's coming. And it makes me all the sadder for you that you're in this rough spot, Randy.
Thank you. Well, I will say my son is housed, and I'll tell you tonight's topic, which is trauma-informed parenting, which helps the healing, to help the healing. We're going to bring on 2 amazing guests who have a website about the trauma-informed parent. I'm going to let them tell us all about it. And I certainly feel like I've been informed about trauma by experience in the past couple of weeks. And what I'm working on is detachment, is letting go, is taking legal steps to do less for my son. And I will say, and this is personal, but I feel like I want to share it for the benefit of anyone else who's going through it. My son is spiraling down right now with not only his schizophrenia, but also what I believe is an addiction. The jury is out as to what the particular, let's just say, marijuana and alcohol and maybe something that's laced in there. For now, we don't know. He won't take a drug test. And so, dealing with that dual diagnosis is really hard. And I have to say that I met, we talk a lot on this program about a medication called clozapine or Clozaril, which is the gold standard, and we're working very hard to make it available to those who want it. But I don't want to forget that there are other medications that work really well. And the teaching point here is that other medications can work well. My son has been on a time-release injection of Haldol every 4 weeks, and until he used pot again, it was working pretty well, I have to say.
And pot, as we know, will actually destroy most antipsychotic efficacy.
Yes. And I ran into a friend, an acquaintance at my temple at services this week, and she happens to run the mental health committee. And I always thought she had been in the past suffering with depression. And she shared with me, no, I have schizophrenia. Like, she runs the mental health committee. She's vibrant. And I said, really? And she's been on Haldol since 1992. And she said 12 hospitalizations until she realized she did have schizophrenia. Like, it was what I still hope someday my son's story might be, but I don't know. And she said that what I have learned is that one sip of alcohol or one puff of marijuana, and it negates what the medication does for me. And so that was a little bit of information about my personal trauma this week. So, we'll see what happens. I am working on just letting his case managers manage him, and I'm staying as detached as possible. But yeah, there's a lot of ways for people to reach you when they're in crisis. So still alive. He's still alive. I'm working on the balance of hope and reality.
That is, I think, a good philosophy for all of us and I say when we are in crisis, because when our loved ones are in crisis, we all are. So I'm so looking forward to this program because I want to learn better how to deal with crisis. As you know, Jim was in the hospital this summer, in and out twice, and not doing well. And we saw psychosis again. And going back into that psych ward, even though it was nothing like what you're going through, it was nothing like what we've been through with Jim, it still brought me back to that, what I call the PTSD place.
Mm-hmm. Absolutely. And if you're listening and wondering where mom number 3 is, our usual mom number 3, Mimi, is in France, and it's very late over there, so she may or may not join us, but we are joined by 2 wonderful women. Please come on, Catherine Galda and Suzy D, as they're turning their cameras on. I know if you're listening, you can't see them, but I met Suzy about a year ago. We live in almost neighboring towns in Connecticut, and I don't remember who contacted who, but we had a lovely 2-hour coffee, swapping stories and swapping coping mechanisms. And I kept saying, one of these days, I got to have you on the podcast. And this is the opportunity. And Suzy was kind enough to bring Catherine Galda on. And well, I will just say trauma-informed parent website. And I'm going to call it up right now because if you're informed about trauma, basically what it says is when parents are trauma-informed, they are better equipped to help their children heal. And I'd say people with serious mental illness in their family get trauma-informed by experience, not necessarily by education, although education does help. So, why don't you guys start, tell us about yourselves, tell us about your line of work, trauma, and how did you get into it? What are your stories?
Wow. Well, try to put that in a nutshell. I mean, the trauma-informed parent
This is Suzy
website,
speaking, by the way. Go ahead.
it really came from an experience I had with my son. And I dealt both with trauma and serious mental illness with my son. But I was working on a book. I work in early childhood education and parenting. So I was working on a book on parenting back in, wow, it was about 2011 2011, maybe 2012. And I was told I should have a web presence, and I didn't really know what that meant, but I thought, why don't I do a trauma-informed website? Because I had learned so much from our experience, and I wanted to really share with other parents and caregivers what was not available to me in 2004 when my son suffered his trauma. He was 7 years old, and we had just moved to Connecticut a year before that. And while trick-or-treating on Halloween night of 2004, on our last stop, his Halloween costume brushed past a candle on a neighbor's porch, and it went up in flames. And he was severely burned on his lower face and his left hand. He was on life support for 2 days. After that, we experienced numerous skin graft operations, excruciating pain. It was a horrific trauma.
Oh my
Came
God.
through the experience with fantastic doctors. The team was wonderful, and came home and going to get back to normal. The word trauma didn't really come up back then. This is 2004, and it wasn't really in the lexicon. And unless you were a professional, that wasn't really talked about, other than his doctor going to the school to give the other kids a heads up, the first graders, of why he was wearing a compression shield. We just got back to normal. And a lot of the trauma symptoms started surfacing around 14, 15, around adolescence. They became pretty pronounced, and we learned a lot through those years. And also there was mental illness there that I believe was there before the trauma. When I look back at who he was as a young boy, there definitely was some stuff there, some learning disabilities, some mental illness. But I think the trauma and that all just exacerbated when he became an adolescent, and it became a very, very rocky time. So that's the history of how trauma-informed parent happened. And the website and the Facebook page, which to my surprise has just grown exponentially. We just post, various resources, information from various experts. And another trauma he endured, which is also how Catherine and I came together, is I live in I live in Newtown, Connecticut, where the Sandy Hook Elementary School shootings happened. And my son was a freshman in high school that day. He was on lockdown for 3 hours in a very small crawl space because he happened to be, I believe it was theater class that day. He became very close friends with a father who lost his daughter in that shooting. He worked for him. This is a long story short, but that father ultimately died by suicide in 2019, which was another huge loss for my son.
Oh my goodness.
I became involved in recovery efforts in the town. I worked for Sandy Hook Promise. I worked as a care coordinator for the Newtown Recovery and Resiliency team, and that's where Catherine and I were colleagues, and how we came to know each other. And through our work in trauma together, she came on board with me on Trauma-Informed Parent.
Wow. Wow. Thank you. And, I will share for listeners who don't know, I work occasionally, well, more than occasionally, but I'm a fill-in talent at a radio station that's 2 towns over from Newtown, and I was on the air when that happened. I remember it
Sorry.
quite well, and also was involved in the fundraising as well. And we did a series of podcasts 10 years after about that, and we interviewed those families, and so talk about trauma.
Yeah.
All right. Yes. And in NAMI, National Alliance on Mental Illness and Family to Family, we teach this concept of what they call a second hit, that sometimes mental illness is kind of hovering and waiting, and that a second hit of trauma or stress can be, not to blame anybody or anything or bring back refrigerator moms or anything like that, but that sometimes stress can exacerbate and bring on symptoms as well, if it was there in the first place. So certainly your son had his share of that, and we'll hear more about that later. Catherine, tell us a bit about your story.
Well, thank you. Thank you all for having us here tonight. And Susie, I think you told it beautifully. I've been a clinician. I'm a licensed clinical social worker and have been in the field of trauma since I started my career back in 1998. Post-grad, I worked in an acute care psychiatric hospital. and was assigned most of the acute trauma that came through, and it was able to kind of spend a lot of time learning about the impact of trauma on late adolescents through adults, and kind of what worked and what didn't. And there was a time period in there where I stopped working for a bit to have my children. And it was right at the when the Sandy Hook school shooting happened that I went back into the field, feeling like I had this wealth of knowledge and experience. I wasn't going to be an individual practitioner or a group practitioner at that time because I'd been out of the field for so long. But I felt compelled because my daughter Hannah, who was also 7 at the time, is a survivor of the Sandy Hook school shootings. She was a second grader at the time. We started her. So her birthday falls at the very end of November, and because of Connecticut laws, you can register for kindergarten up until December 31st. And I remember having these long and involved anxiety-filled conversations with her pediatrician. She's so little, but she's so developed, and I should start her. Should I keep her? Should I hold her back? Should I start her? Should I hold her back? And I ended up sending her to kindergarten when she was still only 4. And as a result of that landed her in second grade at the time. So Hannah's experience, she was across the hall in that front hall from where the shootings took place. And there's a picture that she's in that still, whenever I see it, when it pops up on social media around the anniversary date, I'm sure it'll come up again. But that picture of the children running out of the school with the teachers and the police officers, and that was Hannah's class. And I can still see her little pink jeans. She was the tiniest in the class and the youngest there. And as a result of that experience for her and for our entire family, I felt like I have resource, I have gifts, I have a certain talent in this way. Since I'd been working in the field for such a long time, I myself have my own trauma history. So I've come to the table with lived experience plus my graduate work and my professional experience. I felt like I really had to go back and do something. That sense of urgency, that sense of desire to act. So I did work on a grant from the American Academy of Pediatrics right after the school shootings, and then teamed up with the Department of Justice grant, working with Suzy at the Newtown Recovery and Resiliency team. And that's where we really had an opportunity to bond and share our stories and share our experiences. Two moms talking in at Fairfield Hills, right? Two moms talking about their stories there in those old offices of the old state psychiatric hospital. And Suzy and I have kept in touch since that time, and we've been talking about trauma-informed parent for such a long time, and then finally had it was a strange epiphany, like a strange aha moment when we thought about, well, why don't we kind of come together and bring all of this lived experience and this kind of just conversational way of being and the wealth of research and knowledge that we both have, and create something that people can actually utilize, that can really help them to find a way to make their own trauma-informed home. Right? That whatever that means for them, whatever that has to be for them, it's different. It's different for all of us, all 4 of us here, the way we configure our homes and the way we deal with our children. And so we wanted to be able to create something where we could give the tools so that people could take that information and make it work for them. I think
I have 2 questions. Randy mentioned I forgot what you called it, but when you have trauma, it can trigger mental illness.
Hit, called a
second hit.
Yeah.
So what kind of help did the kids at Newtown get, and how much can getting the right help mitigate, if it can be mitigated, that second hit?
Yeah, and I'm just going to stop for a second, and I feel like I need to make clear, since we are a podcast about having loved ones with schizophrenia, that we are in no way saying that trauma causes schizophrenia. I want to make that really clear. There are people that believe that, and we are not that podcast. We believe it is a genetic, not necessarily inherited, but the odds are greater. It is an illness that exists that can be exacerbated perhaps by trauma, but trauma does not cause schizophrenia. So just, getting
Right.
that perfectly clear. And one of the things that Suzy does is she works as a researcher for author Andrew Solomon, who you may know from his book Far from the Tree, which talks a lot about genetics, I guess, and things that come through families. But he's got a book coming up on youth suicide, and it's important that we know. And in Far from the Tree, did you tell me he has a whole chapter on schizophrenia?
Yes. Yes.
In there. So I don't want to get, I want to focus on this. So yeah, so just I felt like I needed to throw that disclaimer in here. So yeah.
I agree. That's an important disclaimer.
It's a very controversial thing. Oh, excuse me.
Just the disclaimer there, because first of all, my son did not have schizophrenia, at least that we know of. But the mental illness, I do believe, was there before the trauma. In fact, some doctors who would say to me after the trauma, oh, well, he seems to have an obsession with violent movies, and that must be from the trauma. And luckily, I kept journals from the time he was little. And I'm like, no, look, he's 4 years old and he's asking me if he can see these violent movies. Like, this was there before. I'm no doubt, whatever was exacerbated somewhat, of course, but I agree that disclaimer needs to be made.
Yeah.
Yeah. And also Randy already made it, but I want to underscore the refrigerator mom coming back and getting blamed for this. I was on a panel, I think I mentioned on this podcast before, at the University of Minnesota, and it was researchers at the University of Minnesota talking about their the relationship of trauma and mental illness. And we weren't discussing schizophrenia per se, but just mental illness in general. And there is a lot of research to show that trauma definitely exacerbates mental illness. And so what came first, the chicken or the egg for other mental illnesses? But schizophrenia clearly has a genetic component. And then immigration, being in a war, all childhood trauma, all these things add up. I think that's what we're trying to. But I, on this panel, and also the executive director of NAMI Minnesota, made clear that we don't want to go back to blaming the mothers or blaming any kind of neglect or abuse or that sort of thing. So I think that's a really good discussion. So on to my question then, though, can you help with trauma by getting help so that it isn't such a contributing factor to exacerbate?
Absolutely. If you don't mind, Suzy, I'll take first lead on this. Absolutely. I mean, all of the research that's out there right now talks about early intervention as being, basically the key to lessening symptoms over time, and having, young people as well as adults, the earlier we intervene, the less we're likely to compound. Randy, you were talking about dual diagnosis, right? The less that likely you are to see a substance-related dual diagnosis if you have an earlier intervention. Now, when it came to the young people and the whole community of Newtown, there was lots of resources available, and in the aftermath of that traumatic experience, we were flooded by clinicians doing different types of work, EMDR and body work and Reiki and typical like TFCBT for young children.
Can you EMDR has to do with eye motion? I don't know the last one you said.
Trauma-focused cognitive behavioral therapy.
Okay.
So that is more focused to youth when processing trauma. That's what Hannah went through. So Hannah, I had her she was in therapy twice initially after the shooting. So between age about 7 and I think we kind of finished up around 8.5. She wasn't in continuously, but she had 2 different therapeutic experiences. One was a play therapy experience and the other one was a TFCBT experience. Both were effective in their own ways for her and helpful in reducing anxiety and being able to have her kind of feel safe inside of herself. But when we're talking about traumatic experience, I think that some of the things that we can really do as parents kind of piggybacks what clinicians do, which is bringing our young people back to as close to a place of safety as we can, right? Because this thing happened, we can't take it back. It's not going to go away. So we have to acknowledge an age appropriate language and then return our environment as best we can to a place of safety. And that what that translates into really is structure, right? Regular bedtimes, regular meal times, regular activities, letting us, and that's, by the way, that's also true for us. When we're traumatized by an event or a circumstance, we just had Hurricane Milton come through here, right? Thankfully, God willing, and the creek don't rise, we were okay. you know, the whole ramp up is really anxiety provoking. And so in the days after, that's what we crave. We crave a return to a semblance of normalcy. And I will put that in air quotes, right? Whatever that means, so that we can remember that things are still okay. Again, in whatever way that means, things are okay. And that we can continue to function, work, eat, sleep, all of those really basic human functions that help to promote stability and grounding. And so to kind of, I kind of strayed from your question, Mindy, I'm sorry, but bringing it back, getting therapy really depends and when you do that. So getting therapy, having some kind of therapeutic intervention is absolutely important and absolutely something that should happen. When that happens is dependent upon the symptoms that the person is experiencing. It's not necessary to do it right away, immediately, put your young person in therapy the day after something terrible happens. It is, however, a process of talking with them and understanding where they are and really listening as a parent to find out what's going on.
That's
and then
key.
seek
Yeah.
appropriate care. Yeah.
The listening part, because every child's going to present differently, and many of them are not going to want to talk. My son went to one therapist after it and spilled his heart out and cried. We didn't feel she was the right therapist for him. We picked another one, and on the way there, he's like, "Why are we doing this?" And we said, "Well, so you can. We're going to a feelings doctor." We called them. It's like, I already did that. And to him, it was one and done. And we went to the new one, and all he talked about was, the soccer game or the bus ride to school. He was done. But things like play therapy, I see it now in hindsight, music, art therapy, where you're not sitting there saying, let's talk about what happened to you and how you feel, where you're more drawing or singing or drumming. That would have been, if that had been available to me at the time, I would have taken advantage of that. Or for like foster or adoptive parents, I was just reading about a family who had a child who came from poverty, where they didn't know if they were going to eat the next day. How do you let them know that they're not going to go hungry? It's really knowing your kid and what their fears are, and then working with them to help them feel safe around that particular fear.
I was on a panel recently in a Black community in North Minneapolis, here in Minnesota. And one of the panelists was a person whose program was called Cake Therapy, CAKE, cake as in birthday cake. And she was making the big point, kind of like you just did, that lots of young people would rather talk as they're baking a cake or learning how to decorate a cake instead of sitting on a couch and, having to be on the point.
Yes.
Right.
And another thing I think we do as parents too, I know I did this, is if your child has suffered and is in emotional pain, you don't want to see them suffer anymore. So instead of setting structures and boundaries, you give them everything they want, or you over accommodate. And that's actually not, it's tempting, but the structure is more needed, even if they're going to hate you sometimes. It's that sense of safety, saying no to the video game or the dessert before dinner, as my son always asks for, is, letting them know who's in charge.
Yeah, thank you. And I will say two things come to mind. One is that, and I always say that in my experience, mental illness treatment, mental illness recovery is four corners of the table. Structure is definitely one. My son did amazingly well in jail diversion. He knew what time he was getting up. He knew what his chore was. He knew how many cigarettes he could smoke in a day. He said he hated it, but he was his best self in that program. It was when the structure went away that everything went awry. So structure is important. Purpose is something we all need. What am I here for? Who am I helping? And I would say even in those programs, if you could enlist the people who've been there a little longer to make the new ones feel comfortable. I mean, purpose, we all need purpose. So structure, purpose, treatment, whatever that means. And yes, and I would say most cases, or at least many cases, it needs chemical interference to straighten out your brain chemicals, which, if your brain chemicals are going awry, then it often means medication. But treatment can also mean therapy. It can also mean baking a cake with someone and having someone to talk. It can mean exercise. It can mean whatever treatment means to you. And the last thing that we all need is community. I believe a lot of what my son's going through right now is that within a day, he fell into the wrong community. If he had somehow just fallen into a best friend who was an NA, and he was embracing the sobriety movement, I might be in a different position right now. So everything you're saying is so important. We all need those things. You don't have to have a mental illness to need structure and community and purpose and treatment when you need it.
And before we go on, I just have to say, in case we have new listeners, Ben, before COVID, got his structure and purpose with a really fine job. So that was much preferable to the one that he got in jail, but better structure is structure, I guess.
Yeah, structure and purpose. We want pride. I mean, there's a whole lot of things. But when you talk about trauma, for many of us who are parents of people with schizophrenia and siblings of people with schizophrenia, we had no clue until they were teenagers, most of us. And so the trauma that I feel our family is dealing with, I feel that my son's illness has brought trauma to my daughter, to her husband, to my husband, who is his stepfather, and to my grandchildren, who love their Uncle Ben. And the last time they saw him, he was acting really weird, and I will not let him see them again right now. And my daughter cries a lot, and she tells her children, "Well, I'm sad because Uncle Ben is making some terrible choices." That's all So, trauma-informed parenting, if you think, "Oh, well, my kid's past that," what do we need to know and be aware of to help our families and, our loved ones if we can? I mean, the thing with schizophrenia is they often don't know they have it, so they don't have the trauma of knowing they have it, but they certainly must have the trauma of knowing their life is very different from everybody that they grew up with. So, what are these things that, or I just want to acknowledge that the trauma can happen to many members of the family when someone has schizophrenia.
And I would say, don't assume they're okay just because they seem okay. Make time to be alone with them and talk about what they're experiencing as a result, because they may seem fine, but they need to express it one way or another. I mean, Catherine, do you have thoughts on that?
I have lots of thoughts on that. Absolutely. I feel like I'm overheating a little bit here. I'm sorry, my air conditioning is not working, and I get pinker and pinker as we are going through. But when it's like any system, when one individual in the system experiences something, we're all touched by it. And, we're touched in varying degrees in various ways. And, the tricky thing about traumatic experience is that we can have, Randy, you and I can go through the exact same situation, and I may be traumatized by it and experience a lot of symptoms within the first couple of weeks and ongoing for months and months after that, where you don't. And no one has been able to figure out the perfect formula for who will have symptoms that last a long time and who will not. So maybe someone smarter than I will be able to figure that out, but it hasn't come around yet. But when it comes to families, I think Susie's point, connecting with the family members and really kind of paying attention and leaning into them and seeing where they are and seeing if somebody needs support are really important. I think as the parents and caregivers of traumatized individuals, we become vicariously traumatized by being with them because our hearts are breaking, the behaviors are so different, our emotions are flooding, we can have guilt and shame and blame and all sorts of really negative feelings that we don't tend to talk about. And so when Susie and I are working together, we're spending a lot of time focusing on the system around the person who's experienced the trauma. Right. So looking at the caregivers of foster children and how to help them re-regulate themselves, how to help them find moments for taking care of themselves and then not have co-occurring guilt over taking that time and setting that limit. And that's so hard. We can say that. We say that like, oh, you got to go practice great self-care. But it's very hard when there's no one else looking. If you have a choice to do something that will benefit the family or benefit a member of the family or do something for yourself, often we do the outward thing instead of the inward thing, if we're being honest.
And
A lot
what
of
I
the
would-
trauma for me that came back this summer when Jim was in the hospital was the trauma of fighting the mental health system for care for Jim. That just took up all my oxygen, and I had nothing left for the rest of the family when Jim was in his early years. And then we kind of got onto a plateau and kind of knew what we were doing. But every time he gets back in the hospital and we have to deal with HIPAA and whether or not all the psychiatrists will talk with us, all but one did, and that one that didn't was quite a doozy. All of that mud in the system just totally drags me down almost immediately when he gets into crisis again.
Yeah.
Yeah.
And my kids
you
would
were-
often,
Yeah.
my kids would tell me, they're grown now. I have other two children, a daughter and a son, and they would say, they noticed things I didn't know they noticed about how anxious I was, how wrapped up in the mental health system. I even got enmeshed. Like when you have your own history of trauma, which I do as well as Catherine does, early childhood trauma, and your child then goes through a trauma, it's easy, like I was saying before, to want to protect them from all discomfort and to cross boundaries, to become somewhat enmeshed at the expense of, paying attention to your other kids. What we did recently, which was very informative for me, was we saw a grief therapist as a family. It was over Zoom, but because my son died in 2020 because of it was ruled, he was suicidal, but it wasn't ruled a suicide. It was ruled an accident based on the combination of medications he had been prescribed. But we met as a family with a grief therapist, and you don't have to lose a child to meet with a grief therapist. They were grieving before he died. And a lot came up during that meeting of what they were feeling that I had no idea the depth of what they were feeling, because we all grieve differently. My daughter has chosen, she's in med school and has chosen to go into psychiatry, a large part because of what happened with her brother. And my other son is wanting to make movies, but every time he makes a movie, he dedicates it to his brother. I mean, it's clearly staying with them, and you can't protect them from that. Instead, you need to go in it with them and give them a safe space, to process that with you, or with professional help if they need.
My granddaughter added psychology. She has a double major. She's already was majoring in physics, but she added psychology because of largely because of her Uncle Jim.
Mm-hmm.
Yeah, and I have to say, we have yet to do a show on suicidal ideation. We mention it quite frequently on suicidal ideation or death by suicide. But I just read this amazing book called The Bridge, which is about written by an author who had what is the PC? You don't say attempted suicide. What do you say? You don't say committed suicide. You say died by suicide.
Died
Right.
by
So you did say
suicide.
it right. Okay. So he had very strong suicidal ideation in his 20s and did not go through with it. And he wrote this book with 4 scenarios about 2 teens on the George Washington Bridge about to jump off. And in one jumps off and the other one doesn't. On the second one, the first one doesn't and the second one does. The third scenario is they both succeed by suicide. They die by suicide. And the fourth one, they help each other not jump and become friends. And what was so powerful to me was all of it, but just the hope if you just keep going. And they really, it's called The Bridge. I highly recommend it. It talks a lot, very clear descriptions of suicide and manic phases and the power of friendship, and just amazing. But in the part where he talks of them both dying by suicide, they extend the timeline 25, 30 years past when they died to see what the effect is on the family members. And I'm crying in the car. It was so powerful to me. And so at any rate, that we'll do that show another time. I'm so sorry for your family's loss, but your son lives on in his siblings always. That's not a but. That's not to comfort you. Just it is the truth. We don't ever forget those people that are in our lives, and that makes it sad and happy at the same time, kind of, you know. But so bringing back to what we can do, we've got about 10 minutes left and then we'll be at the hour mark. So I want to make sure you get to say what you want to say about your website, what you hope to achieve, like what are some symptoms in young people that we can be aware of so that we can do or give them what they need, the early intervention. Whoever wants to go first. It's a lot of questions, I know.
I mean, I've got one, I know Catherine will have more. So one symptom that I did not realize at the time was a symptom of trauma was anger, or just even, what do you call it when you're always fighting?
Combative?
I'm sorry?
Combative?
Yes, combative. When a kid is 7 and 8, it's kind of cute. And because my son was very combative, but in an interesting, like he would love, if I said I was voting for A, he'd say he's voting for B, even if he liked A, he just liked to get in those arguments. But when he got older, it got a little more serious. And I think I would recognize like quick to anger or as a sign of stress and anxiety. It's not always just a quirky, sometimes it is just their personality, but if they've also had trauma, I'd be more on the lookout for something like that. Then I'll let Catherine, your domain.
And I'm also hearing find the right therapist, not just a therapist.
Oh my goodness, yes. To speak to that really quick and then go back, statistically, we have 3 chances. In the work I do now, we do a lot of work in coordination to assist individuals in finding the right care. Because the right care, everybody has a slightly different hierarchy. It's not always symptom based. Sometimes it's location or price or, what people can do. And, finding the right therapist, you have about 3 shots. And I always tell people when you're looking for a therapist or you're looking for a therapist for yourself or for somebody that you love, somebody that, your child under 18, call them up, have a 20 or 25-minute conversation with them, ask all of the questions that you can think to ask, not just about where they went to school, but what is their area of expertise? What are they passionate about? Who do they like working with the most? In terms of, how old they are or what, because when we use our insurance or we use other screening methods, you could say, oh, well, this person lives, it's 5 miles from my house. It's a good amount of time. They're a therapist. Okay. And they may not have any expertise in what you're looking for, especially when we're talking about trauma or we're talking about severe mental illness. You need to have somebody who knows what they're doing, or at the very least, nothing good is going to happen. And at the worst, something bad could happen, right? They could miss something really important. And not every therapist is perfect for everyone. I've been in the field a long time, and that's why I always do interviews with all of my clients. I want to make sure I'm the best fit for them as also that they make sure that that they feel like I can help them, because otherwise it won't work. 98% of therapeutic experience or therapeutic, intervention is the connection between the therapist and their client. If you don't feel safe, if you don't feel like you can do work with this person, you're going to withhold or outright fib or just not connect. And you've only got like 3 chances, and then people stop trying, and then they suffer longer. Right. And the statistic is like 10 years. So they'll go out and suffer for 10 more years before they come back in.
And it's
that's
very hard to fire a therapist. It's harder than leaving your hairdresser. You're like, I mean, that's really hard too, to try somebody new. So that's really good to know what are the good questions. Are these the types of things that are available for people to know on your website? Tell me about, what you hope to achieve with trauma-informed parent and what people can get there.
I hope to really help caregivers, not just parents, but caregivers as well, as of kids who have endured either a traumatic experience or ongoing trauma, which is often the case with kids from foster care or adopted kids, be able to recognize the signs of trauma versus, say, ADHD or other things, where to get help, um, and what, like for example, when my son was about 15, he had his wisdom teeth out, and the dentist sent him home with a whole lot of Oxycontin or whatever it is.
Yeah.
And
Yeah.
somebody whose kid has had traumatic experiences may know to say, you know what, let's start with Advil, because trauma is definitely something that can lead somebody to want stronger things, especially in adolescence. So that's what we're aiming to do, is like help parents have that aha moment of, wait, they've been through this, maybe we should do something differently.
Yeah. I think that really hits it. That really hits it on the head. Like if we can help caregivers increase their insight, increase their understanding, take a conversational and kind of everyday approach to the content that's out there and the wealth of knowledge of content experts that are out there, and make it something that folks can use every day, that they can look at, and it's almost like a stepping away slightly from their current system, like the way things work now.
Mm-hmm.
Looking at it, we can't be objective because it's our life, right? We could try, but there's no objectivity there. But if we can get above what's happening in our homes just a little bit and kind of look down at it and see what's working and what's not, see who's being impacted and who's not, and kind of
Including ourselves. Can I say including
Yes.
ourselves?
I was going to say that.
absolutely.
Yes.
You touched on this earlier, and we have had episodes, we interviewed our own daughters on one of the episodes. We had an episode on ambiguous grief, ambiguous loss. We had an episode on mothering difficult children. So there are many episodes to get further details of some of these things. And we talk a lot about self-care. And we've had a couple of shows on the spouse experience, and a few people have shared that they're children of people with serious mental illness or children of someone who's gone through trauma, military trauma, different kind of trauma. One of the first things I remember hearing from a therapist when I first actually it was when my husband was abandoning the family, and I was worried about my children. And she said, trauma is hard. Unexpressed trauma is way worse.
Mhm.
And that has to be something that it's still in my mind. It's over 30 years since that
That's
happened.
a
And that was
really
certainly a
good point.
second hit for my children. Uh, I I like what you touched on earlier, so I don't think we need to ask the question, is how do we recognize trauma in ourselves? And how do we take care of ourselves when we, parents or spouses or siblings that are going through loved ones? For instance, last night, I've blocked my son's number right now, but he can still email me on occasion. I can ignore that more easily. And I got an email. I'm locked out of my apartment. Please send money for a motel. And no is the answer. And I basically ignored it. And I like to think I'm good at compartmentalizing, But you know what I discovered last night? My head is really good at compartmentalizing. My heart is not. And my heart kept me awake almost all night
Mhm.
because that, and just to recognize that and give myself permission to feel sad for my kid.
Yes.
And I know what I have to do. I know I have to detach. I know, and I'm doing it, doing what I have to do, but we can also give ourselves permission to feel what we feel.
Yes, you can be the most trauma-informed person, parent, caregiver in the world, but until you've recognized and dealt with your own trauma, it'll be difficult to help the child because it will seep in. If you're, especially if the child is at an age where, when they hit an age that you were when your trauma happened, or if they make demands of you for something that you were not allowed to have, like, they want something and you, all of a sudden it triggers, that you were never allowed that thing. Unless you've processed that and felt it, um, it'll be hard to help the kid without, more than just a rudimentary understanding of what they're going through. So it's important work.
Yeah.
I think I'm still a work in progress, because if Jim has locked himself out, and we live in Minnesota, it's damn cold here if you're out on the street in the wintertime. And so I have never been able to not respond to that kind of a request. So you're a tougher lady than I am, Randy. How did
Well,
he get,
I do
go
believe
down?
he had options and he wanted money for drugs. That was my thinking.
So
Yeah.
he did get back in his apartment. Good.
Oh yeah, he did. And he would have been
Amazing.
$200 richer if I'd given in. So, I mean, we all have to, and this is the thing, we can't make each other feel guilty for
No,
the
not at all.
decisions we need to make. Like, we
You
all
know
want to
your son
know,
and you figured out what was behind it. It wasn't that he was locked out.
well, he might have been too, because he's not thinking straight. And that's, but I think I heard from a friend that I had lunch with this weekend. She says, I understand, because she had a son with addiction and mental illness as well, who's actually doing really well right now. And she said, I had 9 months where I didn't know, I didn't know where he was. But what I need to know is that at the end of the days, I've done everything I could for this person. And then when I couldn't do anything else, I just, let go and let God, as they say. But we do need to know that we feel that we did our best. I have saved this this 42-year-old child through everything, 10 hospitalizations, 3 apartments, you name it. We've all done it. We've all done it. But I won't support him through addiction at the
Well,
expense
when
of
Jim
my own
was in that
depression.
shape, we did have a protective order against him. So I did, I can be
We do what we
steely
have.
if we do what we have to do. And,
So,
And you know
whoever thought you
what?
would do that with your own child.
yeah,
Yeah.
it is. So that, talk about trauma. So just to bring it back, you have the website. It's in the show notes, but please say and tell us about your website, Facebook page, and Instagram, and then we'll give you last words.
Website is traumainformedparent.com. Facebook is the same, just Trauma Informed Parent. Instagram, same. We also have recently started doing webinars. We did 2 webinars that are on our YouTube channel. There is a YouTube channel, which is Trauma Informed P. I think that's what it is,
Okay.
but I can send you the link to that. We did 2 live webinars that are now on YouTube, and we're going to start doing some workshops in the coming weeks.
Yep, we're in
Basically
development for
around parenting, parenting strategies, tools for parents and caregivers of kids who have had trauma.
Okay. So, and then that on those webinars and workshops are more geared toward parenting younger children at this time, younger and adolescent, not grown children at this point, right?
at this point, yes.
At this point. Yeah.
But we can all learn about trauma. Well, thank you so much. This has been so helpful. Is there anything you really were dying to say we didn't give you a chance to say?
Hmm.
For me, I think I'm good. What about you, Susie?
I think so. I think, I'm sure I'll come up with something when we get off, but no, that's it in a nutshell.
Well, thank you. And Mindy, any last words from you?
I thank our guests, and I'm out of questions too. So I think we're at a good point, Randy.
All right. Well, thank you so much. I will get this up as soon as I can. And I'm sure you'll be helping a lot of people with
Great.
this and with everything else you're doing. Thank you so much.
Thanks for having
Thank
us.
you. Yeah, thank you so much for having us. This was wonderful.
Okay. Hey, thanks for joining us for this episode of Schizophrenia, 3 Moms in the Trenches with Randy Kay, Mindy Greiling, and Miriam Feldman. To get in touch with us or to learn more about our books, please visit our websites at miriam-feldman.com, mindygreiling.com, or randykay.com. Hey, thanks for joining us for this episode of Schizophrenia, 3 Moms in the Trenches, with Randy Kay, Mindy Greiling, and Miriam Feldman. To get in touch with us or to learn more about our books, please visit our websites at miriam-feldman.com, mindygreiling.com, or randykay.com.